Well, healthcare architecture is probably one of the types of architecture that is the most complex and more interesting of all the disciplines, of all the styles of architecture out there. I mean, for starters, it has purpose, right? The purpose being that you are taking care of people. People depend on those hospitals, the healthcare institutions, to be able to get well, to be taken care of. So as architects, we have a responsibility to design these buildings, hospitals, so that the public may be taken care of correctly and be able to move them through in the proper way. Everything from the waiting room to the surgery room, it all comes together, and it has to be not only pleasant to the user, but also the doctors and nurses, the hospital, the medical professionals working there, because they spend so much time there. And how about having some of the facilities in those buildings that truly will give the hospital personnel a comfort, or a level of comfort that they may be comfortable working there and wanting to come back. Everything from their cafeterias through the break rooms, and all the in their laboratories, all of that coming together and be able to work in harmony. All of that is important. Then, from a design professional, being able to put together all of this infrastructure that is required to go in through there. For example, all the gases and the liquids and fluids that are going through all of this plumbing system throughout the building, to be able to maintain the proper energy and the lighting requirements. How about the temperature requirements, humidity? There are just so many things that are required in designing a hospital. It's just so critical. Here at Development One, we are looking at designing more hospitals. There's companies that's all they do. That is all they work on. And we are looking at doing a lot more of that, not only because we find these exciting and interesting, but because we feel that those types of projects make a difference in our community, because they are serving those people that need healthcare needs. Hospitals would be a natural fit for us. They fall under the mission critical type of facility. Under the same token, it's important for us to be able to pick those projects that are going to be able to be a natural fit that will continue to be a client for the long term. It's just a business decision that is very, very critical, that you have the training and you have the knowledge that you will be able to use it for the long run. There has been a downturn in healthcare where, design and construction has really dropped. For various reasons. So it may not be the right timing for us to get into that sector just yet. There also may be a glut of healthcare facilities in some areas, not everywhere. We hear different opinions about the market. We are still exploring that, and we are actually considering quite seriously whether we should get in or not. The main reason that I think it's attractive for us to get in is because it appears, at least from a design experience, a good fit to our type of work of mission critical facilities that we design here at Development One.